But first, I'm going to just do a little history, okay? A little bit of history. Okay, so here's my little bit of history. So how did we get here from here? So let me first just kind of walk you through the history of psychotherapy from Professor O'Brien. Okay. So, all right. So it all started in the West with Freud, and you all know about Freud. Freud is very popular, and how can I say? There's good things about Freud, but mostly, I don't want to say bad, but not helpful. Not helpful. And the trouble is, from 1900 to 1970, almost all psychotherapy was Freudian. And that would be okay if it worked. But there's no evidence that psychoanalysis works. No evidence, no research evidence to support it as a therapy technique. So for 70 years, it was the dominant form of therapy, and it has not been demonstrated to be helpful. Kind of a bummer. So why was it popular? I think because this is actually Freud lecturing, and I think why people like Freud is because, one more, next slide, yeah. It is dramatic. Freudian therapy is dramatic. It's like when you go out camping and you're sitting around the campfire and maybe you tell ghost stories. Freudian therapy is like a ghost story. And because what Freud says is inside of every one of you is a monster. Your id, the unconscious. You have deep inside of you evil impulses to harm other people. And if you're left alone, you'll do bad things to other people. So you have this monster inside of you, always trying to escape and make you do bad things. And then you have another part of your mind, the superego, which says, no, 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 bad, 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 bad. So there's this war going on inside of you between good and evil. Good and evil. That's dramatic. It makes you feel like you're a pretty cool human to have this war going on inside of you, and everything is deep and meaningful. And so Freudian was popular because it's a very kind of dramatic kind of therapy, and it makes you feel like I'm really important. And it kind of seems true because we all do have negative things inside of us, and we all do have, ways in which we yell at ourselves. So it kind of made sense. But Freudian therapy was done for 70 years, and I think I have another slide here. It kind of emphasized in psychotherapy some things that are not helpful. So if I'm doing Freudian therapy, when I was in my residency, I had to do Freudian therapy as a student. It was awful. But let me show you what it looks like. You be my client, and I'm going to be your Freudian therapy. You have some kind of a problem. This is Freudian therapy. No talking. If I was doing therapy and they were supervising me, no talking. Maybe 30 minutes. I just sit here. I just wait for you to say something.
You want me to say something?
Up to you.
Good morning. I had a nightmare. Can you help me?
So I can stop there. I won't. So what Freudian therapy is doing is you just sit quietly. It's very uncomfortable for the client. You're sitting there, you're waiting for the therapist to say something, nothing. So then you start filling in Well, what does he want me to talk about? So you start talking, talk. And the Freudians never recognized this. They said, we're just neutral, we're like a blank slate. But they were not. They were reinforcing certain kinds of talk and not reinforcing other kinds of talk. So maybe you continue, we'll show you what it looks like. So continue.
The client is feeling nervous.
Definitely, I'm creating anxiety in you, and you're going to start talking. You're going to start talking to like get away from the anxiety, right? So go ahead, yeah. Now, what I'd be doing now if I was a Freudian, he's not talking, resistance. He's avoiding, he's resisting me. He's resisting talking because he's blah, 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 I don't know what. Yeah. So you can pretend that just start having a problem, whatever, you can start talking about it. So go ahead. Yeah. Yeah, so you could just start talking about a problem, and I'll show you what the Freudians do, but they didn't know they were doing it. Go ahead.
I feel quite anxious recently about so many things, and sometimes I had a nightmare.
Nightmare?
Yes, I had a bad dream. Yeah, now I'm concerned and I worry a lot of things that maybe a lot of bad things will happen. And this made me feel that I can't control my thought and my feeling, and it made me want to always stay alone and just being at home, avoiding from other people, that I don't want to talk to anyone. I just feel that the world is so dark recently. I don't know how can I feel better.
The bad dream?
Yes, I do. I have some bad dreams recently.
What happened?
I don't know, I just fall asleep and then there's a lot of things happen in my dream. It really disturbed my sleep, but then when I wake up, I can't remember anything.
Who's in the dream?
I don't know who's in the dream. Probably it is something that happened in my past experience, I don't know.
The past?
Probably.
How long ago?
Well, maybe since I was a child.
Okay, good. So very nice. So the Freudians were saying, we're just listening, we're not shaping. The client brings up things, and when we listen carefully, they always start talking about their childhood, they start talking about dreams, and so that's how we know therapy works. What they did not recognize is I was selectively reinforcing talk about dreams. He talked about a lot of things, and I say, dreams. And then da-da-da-da-da-da-da-da-da-da-da. Who is in the dream? Da-da-da. So he's learning from me. My therapist likes me to talk about dreams. My therapist likes me to talk about childhood. And over time, I'm going to steer him towards talking about his childhood, steer him towards talking about his relationship with his mother and his father, steer him towards blah, blah, blah. So Freudian therapy was not really neutral. It was moving people towards certain kinds of topics. And the therapists never fully acknowledge that. They say, no, the client's just bringing this up on their own, but they're actually reinforcing it. And we're all doing that anyway. I mean, in CBT, ACT, we're always influencing clients to talk about certain things that we want them to talk about. That happens. But we'll come back to you. So the idea with Freud, it was like silent, non-disclosing, creates a lot of anxiety. It's in an office. We're focusing on the inside of him, what's going on in his mind, not the outside. It's alone. And they did recognize a good thing that there was a relationship between the therapist and the client, and that was helpful. But a lot of the other parts of psychoanalysis was not so helpful. The alone, the quiet, the in office, being silent, not so helpful. So yeah, I can go. Oh, right, yeah.
There's a lot of មានគ្រូពេទ្យផ្សេងៗដែរមិនបានគាត់អ្វីដោយសារតែគាត់ណាជាងត្រាម៉ាបន្តិចគាត់ជាងមកចេញមកផ្លែកសូម្បីតែការไปរៀនគាត់ក៏ធ្វើឲ្យមើលទៅយើងមិនជាបិសាចយើងមានកូនបិសាចក្នុងពោះហើយបែបយើងនឹងតួអក្រក់ចឹងហើយមានមួយទៀតយើងមានអាធីរីពាក់ព័ន្ធជាមួយ iceberg ហើយយើងមាន it នៅក្នុងពោះហើយមាន super ego ដើម្បីគ្រប់ it ហ្នឹងកុំឲ្យយើងខ្លាចជាបិសាចឃើញដល់គ្នា Right? យើងមានចាប់អារម្មណ៍ពេលដែលយើងហ៊ានពី Freud ប្រាប់យើងថាឲ្យលាក់ blank slate យើងអត់ឲ្យដឹងពីយើងទេអញ្ចឹងមិនគាត់លើក example ថាការ Freud ពុំមើលជំងឺគាត់មើលរបៀបហ្នឹងដោយគាត់អត់មាត់គាត់ឲ្យអ្នកជំងឺអារម្មណ៍ភ័យទៅហើយអ្នកជំងឺនិយាយឯងហ្មងនិយាយពីនេះពីនោះប៉ុន្តែយើងចាប់អារម្មណ៍ថាពេលដែលមាន Freud គាត់ចាប់ដើមតម្រង់ទីហើយគាត់ចាប់ដើមចាប់ចំណុចមួយហើយចំណុចមួយនោះតែពាក់ព័ន្ធនឹងសុបិនឬក៏ការអតីតកាលការគាត់នៅក្មេងដោយគាត់និយាយច្រើនណាស់មកគេគាត់និយាយច្រើនណាស់មិនតែចាប់តែយកសោះឲ្យនិយាយពីក្មេងអញ្ចឹង notice ថាវាមាន bias ហើយមិនយើងនិយាយថាវាអត់សូវល្អផងណា quiet ស្ងាត់ formal rigid នៅក្នុងបន្ទប់មួយដូច office មានតែពីរនាក់និយាយពាក់ព័ន្ធតែខាងក្នុងនិយាយពាក់ព័ន្ធខាងក្រៅនៅតែម្នាក់ឯងប៉ុន្តែអ្វីដែលល្អគឺចាប់អារម្មណ៍ថាមានតំណែងជាមួយអ្នកប្រឹក្សាជាមួយ client.
Oh, okay. So we'll make it translate. So one of the challenges is there's research. This is just one example of research that was done on Freudian, and the idea here is this is 0. And these are meta-analyses of psychoanalysis. And you can see that the average effect of psychoanalysis is 0, and sometimes negative, and maybe a couple studies a little bit positive, but research shows that psychoanalysis does not help people. It does not improve their performance. So finally, in 1980, people started thinking, maybe we could do something else. So yeah, we'll stay up here. So next comes behavior therapy. And there's 3 waves. Wave 1, wave 2, wave 3. And one of the things that all behavior therapies have in common is they're based on learning theory, classical and operant conditioning. Oh, I like this. This is fun.
មើលរលក3នៅក្នុងទម្រង់ psychotherapy របស់យើងហ្នឹងវាឆ្លងកាត់ច្រើនអញ្ចឹងនៅក្នុងហ្នឹងមុនពេលរលកទី1គឺ Freud អញ្ចឹងបន្ទាប់មកយើងចូលទៅដល់រលក3របស់យើងហ្នឹងចុងក្រោយគឺទី2ហើយទី1ចាប់ផ្ដើមពី classical operational conditioning ក្នុងលក្ខខណ្ឌ parallel theory យើងធ្វើយើងគិតថាអ្នកទាំងអស់គ្នាគាត់លឺហើយឆ្កែក៏លឺសំឡេងកម្ដៅធ្វើឲ្យគាត់ចាប់ផ្ដើមនិយាយទៅមាត់អញ្ចឹងអាហ្នឹងទៅលើ theory ទី1
And they're all research supported and biopsychosocial, yeah.
អញ្ចឹងមានទ្រឹស្ដីមួយចំនួនដែលត្រូវបានគ្រប់គ្រងទៅដោយការស្រាវជ្រាវវាមិនមែនការឡើងទៅក្នុងទម្រង់របស់ Freud ទេតែធ្វើឡើងហ្នឹង based ទៅលើផ្អែកទៅលើអាបទពិសោធន៍របស់គាត់ផ្ទាល់ប៉ុន្តែអត់មានការស្រាវជ្រាវណាមួយបានឲ្យយើងដឹងថាវាពិតជាមានប្រសិទ្ធភាពនោះទេ
Okay. So what happened is in around 1970, wave 1 behavior therapy, new philosophy, which is we do things, the best way to understand problem behavior is to use learning theory focus on observable behavior and focus on situations. Freud was look inside the person, don't bother with the situation. Behavior therapy said we need to look at the person and their environment and why they do the things they do.
អញ្ចឹងបើយើងនិយាយក្រៅពី Freud ចូលចិត្តមើលពីក្នុងគិតពីក្នុងអាពាក់ព័ន្ធមួយឆាវក្នុងការគិតអីហ្នឹងប៉ុន្តែចំពោះ first wave of behavioral therapy ភាគច្រើនគេចាប់អារម្មណ៍ទៅលើ situation អាលក្ខខណ្ឌខាងក្រៅហើយជាមួយយើងចាប់អារម្មណ៍ទៅលើ client យើងមួយ
So some really important therapy, two very, very important therapies came out of wave one, exposure therapy and contingency therapies. Oh, okay. Exposure therapy is based on classical conditioning, and contingency therapies are based on operant conditioning. And so exposure therapy, you all know about. Exposure therapy is to, if a client has an anxiety problem or if they have depression, the number one treatment for anxiety, depression is exposure therapy, and it's really effective. It's the most effective treatment for anxiety and depression, OCD, all the anxiety disorders and depression, better than medication for the most part.
ចឹងគេគ្រាន់តែបញ្ជាក់ថាចំពោះ exposure therapy ដែលយើងធ្លាប់សិក្សាហើយ contingency therapy ដែលពាក់ព័ន្ធមួយ operational conditioning ហ្នឹងគេថា effective ខ្លាំងសម្រាប់ជំងឺ anxiety ជាមួយជំងឺ depression ដែលវាខ្លាំងជាងថ្នាំទៅទៀត
So good. Yay, new therapy and it's effective. So wave one is behavior therapy. Oh, okay. So we'll skip ahead. Yeah. So the difficulty with wave one is they didn't really deal with thinking. They just said, we'll do exposure therapy. We'll help people learn how to do better with operant conditioning and exposure therapy, but we don't really need to talk about thoughts and feelings very much. And that was a limit. There was a limitation of wave one. So they didn't really deal with thinking.
ចឹងការ wave 1 ពាក់ព័ន្ធជាមួយរលកទី1ដែលគេនិយាយថាពាក់លើអាកប្បកិរិយាឬក៏ behavioral therapy ហ្នឹងអត់សូវចាប់អារម្មណ៍ការគិតប៉ុន្មានទេចឹងវាមាន limit ប៉ុន្តែដល់ពេលចូល wave 2គេចាប់អារម្មណ៍ទៅលើការគិតច្រើន
Okay. So along came wave two. Wave two is cognitive behavior therapy, where they wanted to spend time. We need to figure out how to deal with thoughts, feelings, and actions. Thoughts and feelings were added.
ចឹងមុនហ្នឹងយើងពាក់ព័ន្ធមួយ behavioral therapy យើងខ្វល់តែពី action ទេយើងខ្វល់តែ behavior គាត់ប៉ុន្តែដល់ពេល CBT គឺយើងចាប់អារម្មណ៍ទៅលើការគិតជាមួយអារម្មណ៍ហើយជាមួយ action 3ហ្នឹងចូលគ្នា
Okay. So they still used wave one to change behavior, same, but they added cognitive therapy to change thinking. So that was new.
ចឹងយើងនៅតែប្រើរលកទី1ដដែលពាក់ព័ន្ធមួយ behavioral therapy ប៉ុន្តែយើងថែមពីលើការកែការគិតពីលើនឹងទៀតគឺ cognitive intervention.
Okay. So cognitive therapy usually had certain steps to teach the client your problem, about why thinking influences behavior, identify the bad thoughts, try to change the bad thoughts and replace them with good thoughts. And so that, identify the bad thoughts and then replace them with good thoughts. So notice the thought, identify the thought, help the client believe that it's a bad thought, and then teach them a good thought. So for you, for example, or for me, it would be something like, I'll do me first. I say, I feel unlovable. The CBT would say, well, that's a bad thought. You shouldn't think that way. You shouldn't think that way. Every time you say, I'm unlovable, say to yourself, I'm lovable 3 times. So it's a bad thought. Counter the thought with the opposite thought and repeat it over and over. And eventually I'll learn to love myself. That's the idea of CBT. So the key is thoughts are good and bad. Bad thoughts should be changed. Good thoughts should be embraced. And that's CBT.
ចឹងបើគាត់បញ្យល់ពី CBT ថាលក្ខខណ្ឌ CBT ត្រូវធ្វើម៉េចពាក់ព័ន្ធជាមួយយើងត្រូវបញ្យល់សិនថាការគិតយើង influence សកម្មភាពយើងឬក៏អកប្បកិរិយាយើងហើយគាត់នឹងបញ្យល់ថាអាការគិតហ្នឹងគឺជាបញ្ហាហើយបន្ទាប់មកចាប់ផ្ដើមហៅភ័ស្តុតាងប្រឆាំងជាមួយអាបញ្ហានៃការគិតហ្នឹងហើយយើងចាប់ផ្ដើម practice អញ្ចឹងគាត់លើកឧទាហរណ៍ថាខ្ញុំអត់គួរឲ្យស្រឡាញ់ទេ I am unlovable អញ្ចឹងបើនៅក្នុង CBT គេប្រាប់ថាអាហ្នឹងជា problem ហើយយើងអត់ត្រូវគិតចឹងទេអញ្ចឹងចាប់ផ្ដើមថាអាពាក្យខ្ញុំអត់គួរឲ្យស្រឡាញ់ហ្នឹងជា bad thought ជាគំនិតអត់ល្អអញ្ចឹងនៅក្នុង CBT គឺយើងត្រូវចាប់ផ្ដើម repeat ពាក្យដែលផ្ទុយទៅវិញហ្នឹងគឺខ្ញុំគួរឲ្យស្រឡាញ់ខ្ញុំគួរឲ្យស្រឡាញ់ខ្ញុំគួរឲ្យស្រឡាញ់ដើម្បីប្រឆាំងជាមួយអាការគិតហ្នឹង
Okay. And this is the model for CBT. You have something happens, you evaluate it, and then your evaluation leads to a physical response, like maybe for you, oh, I have to do a presentation. Negative thought, I hope I don't make a mistake, I'm going to fail. Failure leads to, uh-oh, my heart's feeling, I can't breathe. And then that leads to, uh-oh, I need to overthink. So I'll fail, I start overthinking, cognitive response. I start feeling I cannot breathe, physical response. And then I'll have a behavioral response that maybe I talk nervously or I avoid doing the talk. So that's a CBT model.
អញ្ចឹងគាត់បញ្យល់លើឧទាហរណ៍ទៅបងស្រីគាត់ប្រាប់ថាគាត់ត្រូវធ្វើ presentation អញ្ចឹង presentation ជា stimulus ការគិតគាត់គឺគាត់អាចធ្វើខុសគាត់ធ្វើអត់ល្អបន្ទាប់មកគាត់មាន behavior មកមានអារម្មណ៍ណែនធូរឬក៏ពិបាកគេឬក៏អីជាដើមហ្នឹងទៅហើយការគិតគាត់ wait តោះមកអាហ្នឹងវា reinforce គ្នាទៅវិញទៅមកគាត់ធ្វើឲ្យអាពេលដែលគាត់កំពុងតែ present ហ្នឹងគាត់ចាប់ដើមញ័រចាប់ដើមភ័យ I explain
I think whatever she said is right.
Yes.
And so the treatment for CBT, we would teach how to think right. So these are the cognitive treatments. And then maybe biofeedback or relaxation to change physical responding. And then skills development to change behavior. So CBT always has cognitive, physical, and skills building components in it. And that's how CBT works.
ចឹងគាត់បញ្យល់ថា CBT វាមាន3ចំណុចសំខាន់ទី1យល់ពី CBT how it work ចឹងទៅយើងត្រូវឲ្យគាត់ដឹងថាអាហ្នឹងវាប៉ះពាល់ទៅលើផ្លូវកាយអីគេខ្លះហើយបង្កើត skill ឲ្យគាត់ដើម្បីឲ្យគាត់control ការគិតហ្នឹង
So CBT works. And now we're kind of getting philosophy. It has a view of the mind like a machine. In a way, a CBT therapist is like, say, okay, you have a thought that you're unlovable. I take out your unlovable thought and I fix it. And I'll say, oh, you feel unlovable. That's not normal. You should not feel that way. Think of yourself as healthy. And I put it back in his head. And he's going to have good thoughts now. Or for you, I say oh, you feel like you're not good enough. You're good enough. And you don't have to overthink, and I put it back in your head so you're thinking correctly. So CBT is called mechanism. It's a machine model of the brain.
អញ្ចឹងបើយើងគិតតាមរបៀប CBT វិញគឺយើងជា therapist យើងជា fixer យើងអ្នកជួសជុលអញ្ចឹងចំពោះគាត់គិតថា CBT គិតថាខួរក្បាលយើងដូចម៉ាស៊ីនអញ្ចឹងពេលដែលគាត់គិតថាគាត់អត់គួរឲ្យស្រឡាញ់អាហ្នឹងខូចហើយអញ្ចឹងយើងត្រូវយកអាគំនិតហ្នឹងយកមកកែវាឆ្នៃវាឲ្យខ្លាចជាខ្ញុំគួរឲ្យស្រឡាញ់វិញហើយដាក់ចូលទៅវិញ
So this would be CBT for depression. According to Beck, people who are depressed say, I'm broken, I'm unlovable, I'm a failure, my future is hopeless, the world is unfair. So I feel like I'm broken, I can't be fixed, my future is poor, and the world will not take care of me. That's depression. What's the best thing to do under those conditions? If the world is unfair and I'll never be happy and I'll never get better, kill myself. Why not? It's a good solution to the problem. So Beck said this is a model of depression. It's called the Beck triad, like you're trapped inside of your mind.
ចឹងបើនិយាយពាក់ព័ន្ធជាមួយពូ Beck ដែលគាត់បង្កើត CBT ហ្នឹងគាត់និយាយថាពេលដែលយើងនិយាយពី depression ដឹងមានអាគំនិតហ្នឹងចេញមកខ្ញុំ broken ខ្ញុំ ខ្ញុំខូចហើយខ្ញុំអត់គ្រប់គ្រាន់ទេខ្ញុំអត់គួរឲ្យស្រឡាញ់ទេអ្វីដែលខ្ញុំធ្វើអត់ប្រយោជន៍បរាជ័យខ្ញុំអត់ជួយណាគេបានទេអនាគតខ្ញុំអស់សង្ឃឹមមកហើយពិភពលោកអត់អយុត្តិធម៌ណា so ចឹងទៅជួយ give me a second ចឹងនេះជារបៀបអាហ្នឹងប្រកាសជាជំរុញឲ្យគាត់មានគំនិតថាគាត់គួរធ្វើអតិឃាត
And Beck would identify, oh, there's other things that depressed people do, like black and white thinking, good, bad, or overgeneralizing, catastrophizing, thinking the worst. So can go ahead, yeah. So again, it's a mechanistic model, a broken brain. And one more maybe. So I'm going to show how we do CBT. So you can be that patient. I'm going to pick on you now.
Yeah, I will pretend to be patient again.
Yes, okay. So I'll show what like CBT might look like. So you're feeling I'm no good, I'm a failure, my future is hopeless, I'm unlovable, that kind of stuff.
Yeah.
So I'll remember I did Freud before, so I said nothing. Now I'm going to do CBT. My job will be to help him believe that his thoughts are incorrect and learn to replace his incorrect thoughts with correct thoughts. Okay? My super ego.
ឥឡូវមុនហ្នឹងគាត់ធ្វើ Freud អញ្ចឹងគាត់អត់និយាយអីគាត់បដៅឲ្យបងគាគាត់និយាយទៅប៉ុន្តែនៅក្នុង CBT គាត់នឹងព្យាយាមកែគំនិតបងគាយកមក
So what I'll do is demonstrate CBT and then I'll show you how we would do the same thing with ACT and how you'll see how it's different.
អញ្ចឹងគាត់នឹងបង្ហាញរបៀបធ្វើ CBT ហើយបន្ទាប់មកគាត់ធ្វើ ACT.
Okay. So tell me what's going on.
Yeah, so there's been quite a lot of things happening in my life. Yeah, and it made me feel like I am not lovable, I am not capable.
Okay. Go on.
Yeah, so I don't know, but this really disturbed me a lot. I feel that I am a failure. I can't really do my job well, and I feel that like people don't really value what I am doing. That made me feel more like worse, thinking about myself. That I shouldn't do that job. I should quit, and that I should do something else.
Okay.
Or look for a new job or something like that.
Good. So I'm listening from a CBT model and I'm hearing irrational thought, bad thought, bad thought, bad thought, bad thought. And I'm going to try to get him